Hello, I'm Nurse Maria. Dr. Jason Wong has put together this video for you. In this video, we will be discussing the remainder of your day. Congratulations on the removal of your wisdom teeth. We will discuss bleeding, swelling, eating, brushing, rinsing, and your prescription medications that have been prescribed to you. For the remainder of your day. For the remainder of today, we ask that you not spit. Spitting will only dislodge your blood clots, allowing for further bleeding. If you really want to clean the inside of your mouth, we ask that you use a paper towel and wipe the inside of your mouth. Avoid using a drinking straw. This again will dislodge the blood clots. If you want to, you can use a spoon, or you can also just drink normally from the cup. For those of you who smoke, we ask that you refrain from smoking several days following the removal of your wisdom teeth. Smoking can increase the chances of infection, compromise the healing, as well as cause something known as dry socket, which is extremely uncomfortable. Following the removal of your wisdom teeth, Dr. Jason Wong would have placed some stitches or sutures in the area. We ask that you try to avoid poking, prying, or playing with the area with your tongue. This will only cause unnecessary bleeding in the area. We ask that you not touch the surgical areas for 1 week following the removal of your wisdom teeth. Let's talk about bleeding. Minor bleeding is normal. You will have a little bit of bleeding several hours following the removal of your wisdom teeth. If you happen to go to bed and you're still oozing just a little bit, don't be alarmed. Some people will have a bit of bleeding the following day. We ask that you not sleep with anything in your mouth. You would have been given some 4x4 gauze. We ask that you change your gauze every 20 to 30 minutes following the removal of your wisdom teeth. Keep changing your gauze until all of the bleeding has subsided. To change your gauze, we ask that you take your 4x4 gauze and keep folding it in half until it looks like a little square. You're going to do the same on the other side if you had all 4 wisdom teeth removed. You're going to take your 2 folded squares, folded sides in, and you're going to place them inside the mouth as far back into the corners of the mouth as possible. It's not the soaking of the gauze, but rather the pressure on the area that will help clot. Don't forget to change your gauze every 20 to 30 minutes until the bleeding has fully subsided. It can take several hours for the bleeding to stop. Swelling. Swelling is very normal following the removal of your wisdom teeth, and everybody varies. Some people will swell quite a bit, and some won't have any swelling at all. Do not be alarmed if you start seeing a little bit more swelling day 2, day 3, and day 4. Those are typically the worst days for swelling. There are several things we can do to help alleviate the swelling. Number 1, ice your face. Take an ice pack. Externally, you're going to hold the ice pack for 20 minutes on, 20 off, 20 on, 20 off. If we removed your wisdom teeth on both sides of the face, you can also alternate 20, 20, 20. Keep doing that until bedtime. Also continue to ice your face 2 days following the removal of your wisdom teeth. Number 2, we ask that you elevate your head. So when you're sleeping at night or when you're watching a movie or two on the couch and relaxing, we ask that you elevate your head by propping yourself with a couple of pillows. This elevation will help keep the swelling down over the next several days. Some people bruise, some people don't. So don't be alarmed if you see a little bit of bruising on the sides of your cheek leading down to your neck. This can be anywhere from brown in color to yellow. Everyone's most important question: what can I eat? Following the removal of your wisdom teeth, we're going to ask that you consume a soft food diet. Try avoiding chewing on the back gums if possible. Dr. Jason Wong would have placed some stitches back there. Don't worry, they'll dissolve and fall out on their own. But what you can do is chew soft foods to help with the healing. Soups, pastas cooked really well, mashed potatoes, scrambled eggs, yogurts, milkshake, ice cream, but with that milkshake, avoid that straw. Try avoid chewing on the back gums if possible. We ask that you avoid temperature hot foods just for the first day. Anything too temperature hot will promote the bleeding. We also ask that as soon as you get home, stick to a non-chew food item like a soup. The first couple of hours it will be difficult to swallow because Dr. Jason Wong would have given you some freezing. So you're going to be pretty numb the first several hours. Once the freezing wears off, then you can go ahead and consume your soft food diet. Your soft food diet will continue for 7 days following your procedure. After a week, you may resume a normal diet. Stay well nourished and well hydrated. This will help you heal faster and more comfortably. Let's discuss something that is extremely important: your oral hygiene. We ask that you not brush your teeth or rinse your mouth the day of your procedure. That will only prolong the bleeding. A day following the removal of your wisdom teeth, you can go ahead and start brushing your teeth and rinsing, but avoid the surgical areas when you're brushing. Just brush forward. When you start brushing your teeth a day following your removal of the wisdom teeth, just avoid the surgical areas. We ask that you do not touch the surgical areas 1 week following the removal of your wisdom teeth. 1 week following the removal of your wisdom teeth, you are permitted to start brushing the surgical areas. If you removed all 4 wisdom teeth, then you're going to brush all 4 areas. With a clean, soft toothbrush, gently brush directly on the surgical areas. If there are any sutures or stitches remaining, the brushing will help dislodge those stitches. Don't be alarmed if you see some gingival bleeding the first several times that you start brushing. That is completely normal. Rinsing. Again, we ask that you not rinse at all the day of your procedure. This will only prolong the bleeding. We ask that you start rinsing the day after. The day following your procedure, we ask that you start with a warm saltwater rinse. This warm saltwater rinse acts like an antiseptic to help kill the bacteria in your mouth. This will help prevent any infection. Take a cup of warm water with half a teaspoon of salt, stir. You're going to swish for 30 seconds. You're going to open, don't spit aggressively, just open and let the water drizzle out naturally. You're going to rinse 3 times a day for at least 1 week following the removal of your wisdom teeth. We ask that you avoid any alcohol-containing mouth rinses like Listerine for 1 week following your procedure. Your prescription medications. You might have been prescribed several medications following the removal of your wisdom teeth. We ask that you follow the instructions that were given to you by your registered nurses carefully. Some people may experience a little bit of sensitivity to the medications. We ask that you take it with a full glass of water or a little bit of food. Some may experience some sensitivity to the prescription medications that we have given you. If you experience any nausea, vomiting, or diarrhea, we ask that you please contact us. If you are prescribed an antibiotic, we please ask that you complete the full course of your antibiotic. This will help prevent any infection. 1 week following your procedure. Your Monoject irrigation syringe. 1 week following the removal of your wisdom teeth, aside from brushing the surgical areas with a clean, soft toothbrush, we're also going to advise that you start with your Monoject syringe. This Monoject syringe would have been provided to you in your post-operative bag. What you're going to do is you're going to just draw up a little bit of warm water. You're going to use your finger, pull your cheek out like that. Get the tip directly inside the surgical areas. You're going to see 2 holes at the bottom where we removed your lower wisdom teeth. You're going to get the tip directly inside the hole and you're going to flush. The upper wisdom teeth are not seen as well, but we still want you to clean the area. So again, draw up some warm water, pull your cheek out, get up, find the back molar, try to visualize where those upper holes would be, and flush. You want to use 1 syringe full or more on each of the socket areas. Continue to irrigate or flush your surgical areas at least 3 times a day or following meals. The surgical areas will take roughly between 2 to 3 weeks for full healing. So continue to irrigate your areas until those areas close fully. Thank you. We hope that you have a smooth recovery. If you have any questions or concerns, please do not hesitate to contact us.